For the record, my name is Kenzie Bach. I'm the District 8 City Councilor and also the Chair of the Boston City Council's Committee on City Services and Innovation Technology. I'm joined here today by my colleagues, Councilor Liz Braden of District 9 and the sponsor of this matter, Councilor Ed Flynn, District 2 and Council President, and Councilor Erin Murphy at large. This public hearing is being recorded. It is being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. And we will be taking public testimony at the end of this hearing. So if you're interested in testifying, you can sign up in the corner over there on those sheets. Or if you are watching this virtually and you want to testify, please email ccc.csit@boston.gov and we'll get you that link. So that's ccc.csit@boston.gov. And that's also the email that you can send any written testimony to. So even if you're watching this after the fact, we welcome your testimony. Today's hearing is on Docket 0292, Order for a Hearing Regarding Access to Low-Cost Veterinary Care. We'll be hearing in a moment from Dr. Alexis Trzynski of Boston Animal Care and Control and Dr. Sarah Sanchez from our Bureau of Infectious Diseases for the Boston Public Health Commission. And then we'll be hearing from a number of community advocates and folks involved in this work of animal rescue and some of our clinical professors from Tufts. But before we get to all of those, I want to allow Councillor Braden as the sponsor to give an opening statement, and then I'll briefly recognize my colleagues. Councillor Braden.
Thank you, Madam Chair, and thank you to my colleagues and representatives from Boston Animal Care and Control and Boston Public Health Commission and invited panellists for being here this afternoon. What prompted my interest in filing a hearing order on this topic were conversations with constituents who expressed difficulty in accessing low-cost veterinary care, particularly Alston-Brighton residents in public and subsidised affordable housing developments, such as the over 250 units at BHA's Faneuil Gardens and the 400 units at Commonwealth Development in Brighton. That led to conversations with veterinary professionals and learning just how hard hit the veterinary workforce has been during the pandemic. Like so many residents of Boston and further afield adopted pets and as companion animals during the pandemic when we were all in sort of lockdown, and so that increased an incredible increase in demand for veterinary services, and then also the associated decline in workforce across all sectors as a result of the pandemic. I'm very grateful to be joined today by Director Alexis Trzynski, I got it right, I hope, of Boston Animal Care and Control, and Dr. Samir Sanchez, Director of the Bureau of Infectious Diseases from BPHC. We are also joined by leaders representing our reputable veterinary care hospitals, non-profit organisations and teaching institutions in Boston and in Massachusetts. Elisa Krieger, Community Outreach Program Director for MSPCA Angel, Dr. Edwards Chetino, I'm not doing a good job with these pronunciations, President CEO of Animal Rescue League of Boston, Dr. Leslie Sharkey of the Department of Clinical Sciences at the Cummings School of Veterinary Medicine at Tufts University, and Director Jennifer Grady, the Department of Clinical Sciences at the Cummings School of Veterinary Medicine at Tufts University. While it may not many will not automatically make the connection, I view this issue as interconnected and interrelated with the hearing we had this morning on census and demographic data for policy making. As our communities continue to change, we have seen an influx in luxury development, including at times specialty and subscription-based veterinary services. And part of the holistic community planning should also mean meeting the needs of all of our community members. Pets have increasingly become integral to our lives and families, including improving mental and occupational health. And any type of demography must adequately account for families of all compositions in our city and the services that they need access to. We think about growing populations. I know we have conversations with the Parks Department about the need for more dog parks and recreational play areas for our animals. And we also see increasing concerns about zoonotic diseases, etc. So there's a lot of interconnectedness, intersectionality along many aspects of this conversation. So I hope that we can have an initial conversation in identifying any access gaps and areas for collaboration, as well as the Council and members of the public to learn about what programs have been going on and have been done well with our city agencies and industry partners. And I really look forward to the conversation this afternoon, and thank you all for being here. Thank you.
Thank you so much, Councillor Braden. Councillor Flynn?
Thank you, Madam Chair, and thank you to the administration team that's here as well. Animal care and control play a critical role in our city. And just want to say thank you for the great work you do for the residents. I think what Councillor Braden is calling for is an important discussion in trying to help residents that their pet plays a critical role in their life. And our pet, we have a little dog we got from the Angel Memorial of South Huntington Avenue in Jamaica Plain. And as a disabled veteran, I know how important it is to me to have that little dog that we've had for 7 years, but I know how important it is for other veterans, but also for seniors and people that are lonely and families too. The pet is part of the family. So just want to say thank you to the sponsor. My dog's name is Marley, M-A-R-L-E-Y, and I wanted to make sure the dog had a middle name, and since the dog was from Jamaica Plain, in memory of James Michael Curley, the dog's middle name is Curley, so Marley Curley, so Molly Curley Flynn. It's kind of a good name. So I just want to say thank you to Councillor Braden. Thank you, Madam Chair.
Thank you, Mr. President. Councillor Murphy.
I knew this would be the best hearing, so I made sure I was here. I've met Marley walking up the street, up Broadway before. And I also have a dog, and a family always had a dog, and my kids are young adults now, but we've always rescued a dog. We now have Murphy, who's been with us for over 3 years and is a family member, and have cats and fish and pets in the house, and know how important that is. But before I go on about that, I do just want to say congratulations, Alexis, on your well-deserved Shattuck Award. I know, yay, we should all, yeah. When I first got sworn in December, one of the first departments I visited was yours, which I learned was under the Parks Department, and saw your, space, and I know we're advocating and just all that you do, and knowing that animal control in the city is so important. But then also, like I said, pets are our family, and as the chair of public health, I do think this ties into our mental health and our public health crisis we're going through. For a lot of people, the isolation, the pet was what kept them alive and kept them going for many people across the city. And we just need to support those families. I know the studies, they predicted that many people would bring in a pet, but then not keep it once we went back to work, and they found out that we did, right? You would know more about that. Families did keep their pets, and they do need them for that support and that companionship just as much as they need us. I always say my dog rescued me, just like they say he rescued. But to just make sure that families, because it can be really hard on a pet owner if they have to choose between pet care and not. It's like when a mom, and at times when not have to choose between, are we going to get our shots? Are we going to keep the electricity on? It's the same with pets, and that for the animals, they need the health care as much as humans do. So to make sure that we're not keeping pet owners away from access to quality pet care is so important across the city. So thank you, Councillor Braden, for bringing this important issue up, and I'm here to advocate and make sure that that support is there for pet owners. Oh, and one last thing I have noticed at the last couple of years, which is wonderful, at food banks, you see that there's always tables now for dog and cat food and cat litter and pet food, which is important, also like feminine products, but we're definitely doing a good job there. I know we can do better. So any donations I bet you would love to have, because people definitely need, pet food can also be costly. So thank you, and I look forward to the work ahead.
Thank you so much, Councilor Murphy. Yeah, and I'll just say for my part that, I know that pets are a critical part of the family for many households in Boston, and that relationship to pets, exists across all income gradients. So if folks don't have lots of disposable income, but they still have a beloved family pet, then that's a real challenge. And so eager to hear about sort of the state of things and how we on the council can be helpful in providing better low-cost veterinary access for folks. And grateful, echoing Councilor Murphy and others for all that you guys do. But why don't we let you tell us about what you do and what the challenges and opportunities are that you see. So without further ado, I'll pass it over to Director Alexis Trzynski from Boston Animal Care and Control and Dr. Sarah Sanchez from BPHC.
Thank you, Madam Chair, fellow city councilors and
do you
panelists.
mind, forgive me, Director, do you mind just, maybe shifting, only because the folks who are watching at home won't hear it as clearly if it's not on the mic. So.
My name is Alexis Trzynski. I'm the Director of Boston Animal Care and Control. Since 1987, each spring and summer, Animal Care and Control has offered low-cost rabies vaccine clinics, rabies and dog license clinics in various neighborhoods across the city of Boston. Residents are able to bring their dogs and cats for $5 rabies vaccinations and dog licenses. These clinics are currently held at the BCYF community centers across the city to increase accessibility and convenience for City of Boston pet owners. While the clinics are not income restricted, many of the pet owners at past clinics self-identify as low income, senior citizens, or folks that are otherwise experiencing barriers to accessing routine veterinary care. Additionally, we are aware that area veterinary clinics, both general practice and emergency vet clinics, have reported an increased caseload. Our own transfer partners who are typically well-connected have communicated difficulty accessing timely appointments and spay-neuter. In response to constituent requests for low-cost services and understanding the challenges facing the veterinary profession, we expanded our services in 2021 from rabies vaccines only to include exams, distemper vaccines for cats and dogs, flea tick preventive, and microchip implants. We also held additional clinics, not just in the spring and summer, but also summer into fall to cover that gap. In the fiscal year 2022, we provided 949 distemper vaccinations, 935 rabies vaccinations, and 485 microchips, all at free or low cost. We also offered low-cost spay-neuter referrals. We were able to provide these services as we collaborated with the local humane organizations, the MSPCA, Angel, and the Animal Rescue League of Boston. To reduce impact on budget, we received some funding via a grant from the Banfield Foundation in 2021, which this council approved. The Banfield Foundation has also awarded us funding for this year's clinics and funding to cover 7 additional clinics in 2023. This month, we are also collaborating with the Street Dog Coalition to hold a clinic in Roxbury for that folks who are unhoused or facing housing insecurity. In addition to the work that we do in the community, so far, Animal Care and Control has provided crisis boarding to approximately 84 residents, provided veterinary care to 650 domestic pets, cats, dogs, hamsters, gerbils, and spay-neuter services at the animal care facility and referrals. When appropriate, we also extend our low-cost services when animal control officers, as part of investigations about appropriate level of pet care, clearly communicate with us that providing owner support and education over prosecution is warranted. The Animal Control also operates a small pet pantry, and last month alone, we sent out over 120 bags of cat food, 8 bags of dog food, and 35 boxes of cat treats. We are proud of the work that we've accomplished in collaboration with our community partners. We also recognize that additional support beyond preventive care is needed. Our animal care facility continues to deliver high-quality veterinary care but our ability to support additional services is limited to functional space. We are grateful to share, grateful and excited to share and show appreciation to Mayor Wu and the administration for including in the capital budget a new shelter design. It is clear from speaking with city members of the City Council that, and the administration, that there's a high level of support for animal care and control. We hope that with the new shelter, we will be more centrally located, more accessible, and the new shelter will allow for expansion of existing programming and creation of new programming.
Great, thank you so much,
I'll
Dr.
turn it over to our colleague from the Boston Public Health Commission, Dr. Sanchez.
Yes, hi. Good afternoon, Chairperson Bach and members of the committee. My name is Dr. Sarah Sanchez, and I'm the Medical Director of the Infectious Disease Bureau at the Boston Public Health Commission. And I really want to thank you for bringing us together on this important topic. The Infectious Disease Bureau leads efforts to prevent and mitigate the impact of zoonotic diseases, defined as diseases caused by germs that can spread between animals and people. Zoonotic diseases are very common, and scientists in the Centers for Disease Control and Prevention estimate that more than 6 out of every 10 known infectious diseases in people can be spread from animals, and 3 out of every 4 new or emerging diseases, infectious diseases in people, come from animals. So the complex links between human, animal, and environmental health require coordinated, multidisciplinary, and multi-pronged collaboration to address the threats from zoonotic diseases. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. This approach can prevent outbreaks of zoonotic diseases in animals and people, improve food safety and security, reduce antibiotic-resistant infections, and improve human and animal health, and importantly, protect global health security. Our team of public health nurses collaborates regularly with the city's Animal Care and Control Office to respond to cases of suspected or possible rabies in animals and prevent infections of humans by coordinating care for post-exposure rabies vaccination. Rabies is a deadly disease for humans, yet entirely preventable by vaccinating pets, including animals that may be homeless on the streets, and the Animal Care and Control Office's efforts to support a low-cost rabies clinic are critical for these efforts. Salmonellosis, another zoonotic disease caused by Salmonella bacteria, causes nearly 1.35 million infections, 26,500 hospitalizations, and 420 deaths in the United States every year. People infected with Salmonella can develop diarrhea, fever, and abdominal cramps. And pets can also get sick from Salmonella and may be carriers of the bacteria and pass it on to their human companions without appearing to be ill. Pets who might have Salmonella require testing through the Veterinary Laboratory Investigation and Response Network, highlighting the importance of prompt access to veterinary care for the health of the entire household. Finally, over the past months, our team at the Infectious Disease Bureau has been working to provide health education to Boston residents infected with the monkeypox virus on strategies to prevent infecting others, including pets in their home. While we are still learning which species of animals can get monkeypox, there has been a single report of sick people transmitting monkeypox virus to animals, specifically a dog. Individuals with pets are instructed to call their veterinarians to have the animal evaluated and tested if their animal appears sick within 21 days of having a contact with a person who has probable or confirmed monkeypox, again highlighting the importance of access to veterinary care in the health of the household. So in summary, I hope that this testimony highlights the importance of low-cost veterinary care as part of a One Health approach that supports human, animal, and environmental health to work together to achieve the best health outcomes for all. Thank you again to the committee for allowing me the opportunity to testify today, and I'm happy to answer any questions. Thank you.
Great, thank you so much, Doctor and Director. Go straight to Councilor Braden for her questions.
Thank you. I'm curious, how do we know how many pets we have in the city? I know people are required to register their dogs, but do you have access to that data?
So we currently have about just under 11,000 licensed dogs in the city of Boston. Estimates total population of dogs somewhere between 90,000 to 90 plus thousand. Just a rough estimate.
How many thousand?
About 90,000.
No.
90,000.
All right, yeah. So, and not everyone chooses to register their dog.
Right.
Is that a problem?
Yeah, so licensing the dog provides animal control the ability to connect with pet owners to provide information about things like our low-cost programming. It gives us access immediately to the rabies information in the case of an animal either has bitten someone or has been bitten by another animal. So it is really important for individuals to be able to have their dogs currently licensed, local animal control.
And the other issue that we see more of now is that there's more wild animals actually living in our neighbourhoods.
Mm-hmm.
And do you have a role in handling those sort of incidents if there's been an interaction between a wild animal and a domestic pet in the city?
Yeah, so usually conflicts with domestic pets and wild animals that are immediately brought to our attention is if the animal has been bitten or bit a wild animal. We encourage constituents to exercise strategies such as making sure trash is maintained properly, encouraging pets to be leashed when they're outside in areas where they know, for instance, coyotes exist, and just reinforcing some conflict aversions. Typically, the complaints from our constituent base are related to coyotes, the presence of coyotes in neighborhoods. Mm-hmm. And we have on our landing page some information on how to avoid conflicts with coyotes specifically. Yeah.
So then back to you mentioned low-cost rabies and vaccine clinics. Mm-hmm. You do those in the spring and the fall.
Yes.
How many? And do you do them across the city? Like I'm from Alston Brighton, yes. So my constituents are asking about this issue. And how are the vaccine clinics spread across the city?
So it's interesting you brought that to our attention. We also received feedback that Alston Brighton was in need of a low-cost clinic, and so we have a clinic in Alston Brighton this fall. We have typically held our clinics in Dorchester, East Boston, Mission Hill, and have expanded them into areas we haven't touched in a while. So this year we'll be doing Hyde Park, Alston, the Back Bay, South End area, and the south part of Dorchester. Yeah.
And the other, I know from being a pet owner myself in the past, the spay neutering programs are really important. Do you have a partnership with low-cost spay neutering programs that you can refer pet owners to?
Yeah, so we do some limited surgeries at our animal care facility. We also have information from our animal welfare organization partners, the Animal Rescue League, MSPCA. They have a pretty robust spay neuter program. The Mass Animal Fund also, through the state, provides vouchers to residents who are unable to pay for spay neuter services, and we have a running list, and we distribute vouchers under that program to our constituents.
Very good. Thank you. That's all I have for now.
Great. Thank you so much, Councillor Braden.
Thank you.
Councillor Flynn?
Thank you, Madam Chair. And again, thank you, Doctor, for the important work you're doing. So just as a follow-up maybe to Councillor Braden's, one of her questions on some low-cost care, but I probably should know the answer to this, but does the city of Boston or does the state of Massachusetts provide any type of almost like insurance for your pet, where you pay something each month, maybe $100 or something, but if your pet does get sick, you have the insurance to bring the pet to the clinic, the medical clinic?
I'm not aware of any programming through the government that allows for insurance for pets. We operate in a referral basis, so we do have resources that we can try to distribute for folks who are having trouble accessing urgent and emergent care. And it is definitely one of the concerns that we have, that we're not really able to support our constituent base. And we hope that with the construction of the new animal shelter, we are able to run a clinic that would address some of those issues.
Okay. Do we know, or maybe, I don't know if Council Bach or Council Brady might know this, but do we know if there are any cities across the country that do that type of service, that provide some type of insurance, where if your pet does get sick and you're paying into this pot of money, that you do get some type of insurance or some type of medical care based on the monthly payment you send? I was just wondering if there are any other cities across the country that might do something like that.
Yeah, again, I'm not aware of that. I know that there are private organizations and companies that do allow people to insure their pets.
Okay. Thank you, Madam Chair.
Great, thank you, Councillor Flynn. I guess following up on Councillor Flynn's line of questioning about comparative stuff, is there anything that you guys look across the country and see other cities doing that you wish that we had the capacity to do in Boston on this front?
For the division specifically,
Sure.
yeah, it would be wonderful to have a standing clinic where we're able to address the needs of our constituents without relying so much on the support of the private agencies that are currently existing in the city of Boston.
Great, and who, for my reference, do you know of other cities that have that?
Yes. I believe Springfield, Massachusetts, the municipal shelter also has a clinic existing.
Great.
Yeah, and I would say, I mean, I think broadly speaking, we do need to center more around surveillance of, zoonotic diseases as we think about both animals and people. And I think an excellent example of that is in mosquitoes. We often sort of track, mosquitoes that test positive for certain diseases like West Nile that can be transmitted to humans, and that's here available in Suffolk County. And so I think that's a nice analog of what we can expand upon as we think more about the One Health approach.
Got it. And I mean, what would tracking those things better entail?
So, for example, I mentioned the salmonellosis cases. That was actually quite recently in pet food that we had seen sort of cases of salmonella. We see other diseases, and I think just trying to, envisioning support for households, we might see more, we might potentially see more reporting of such cases and sort of more diagnoses, for example, in human counterparts in the home, if there is more access or sort of more to sort of that type of animal care is what I would sort of potentially conjecture.
And do you, this is a question out of ignorance from my perspective, if I bring a pet in to a veterinarian and they diagnose it with a disease like that where there is some, risk to humans in the household as well. I guess does the veterinary community also focus on that risk on the human side? Is there communication with the doctors? I'm just sort of wondering, is that public health piece a standard piece of our veterinary education, or is that something we need to work on? How should I think about this?
I think it's definitely something we need to work on, sort of more of that collaboration across public health scientists, veterinarians, physicians, and epidemiologists. Certainly in the individual household, that communication might exist. However, I think globally speaking, sort of the understanding, even at the commission, for example, of what education we might need to offer, depending on what we see in our own Boston households, I think would be important. And that would rely on more needed communication like you outlined.
Mm-hmm. And what are sort of the trends on the exotic pet front these days? Is that up or down? Does that bring particular disease risk factors? When we talk about, I don't know, parrots and reptiles. We've been talking mainly about dogs and cats, I feel like, because those are the dominant pets of the city, but just sort of curious about whether the controls on those have gotten better or worse in recent years.
I think with exotic animals, I'm not as, I don't have that information, but I'm happy to certainly provide it at a later point.
So we don't, as far as animal health or?
I was just curious what the trends are. I know that there was a while back, there was sort of a move to discourage the traffic of exotic animals in various ways. I know certain pet stores stopped carrying certain types, and I'm just kind of curious. It's not something that I've paid close attention to, but whether there are strong trends on that front.
I wouldn't have that data readily available. The exotic pets, if you're talking about hybrids and those types of animals, that data might be available from the Department of Agriculture, but I don't have that readily available.
No worries. And in terms of things that the council can do, I mean, obviously supporting, you guys have a design study, as we all know, capital design studies need to actually be carried out, and then they need political support for turning into actual buildings. But what are the other things that you think that, and I mean, I think Councilor Braden's already modeled a good example of saying, hey, we've got a bit of a desert in terms of access to a clinic here. Can we have one of the pop-ups in Alston Brighton? But are there other things that you guys wish that those of us who hang out here on the 5th floor of City Hall were focused on?
Yeah, so I think that this is a good example of City Councilor bringing to attention a pocket of or a neighborhood or a segment of population who are not being able to access city services. So just a communication back to animal control. We focus a lot on collaboration to be able to provide these services. And so if we are aware, we can generally execute whatever additional support is needed. We have several organizations at this point who have reached out that are interested in providing support to the City of Boston residents. And so it's just a matter of sort of communicating that back to us.
Great. And what about multilingual resources? Like how has that piece progressed on the animal care control side?
So most of our critical documents have been translated into the sync languages that the City of Boston requires, and so residents do have access to that. If they call in, we're able to access the interpretation that the city has in place. A couple members of our veterinary team are bilingual in Spanish, but we don't have any additional staff members who are fluent in any other language other than English. And
do you know if we've ever done like a clinic pushing on, like for instance, like targeted in a particular community with another language?
So I know that as a sort of byproduct, when we do clinics in East Boston, typically that population is heavily Spanish speaking, and so we do have mechanism in place to make sure that communication between the residents that we are providing support to, are able to clearly communicate with us.
Got it. Yeah, no, that just seems another area that obviously we're trying to excel in more across the board in the city. And
absolutely, I think that we could definitely use a bilingual candidate in the field for the work that we do out, animal control officers providing support for stray dogs or animal bites. So that's something that we definitely have on our radar.
Awesome. And if somebody, my last question, and this is more just in the public PSA category and something I should know. If somebody does experience an animal bite, what steps would you recommend that they take? So
they should definitely contact us. As Dr. Sanchez said, we have a really great relationship with Boston Public Health Commission. Whether they live in the city of Boston or outside, we are able to quarantine the animals if they're within the city of Boston, or provide information for them if the animal resides outside of Boston. So primarily when we're concerned about animal bites, we're talking about the risk of exposure to rabies virus.
Great. Councilor Braden, follow-up questions for the panel?
As we think about this past summer, we've had several heat waves, and folks, we've had brownouts in Alston Brighton, and folks had to go to a cooling centre. So one of the questions that constituents were saying, if I need to go to the cooling centre, can I bring my pet with me? So in terms of thinking about emergency planning, I know I had family members who had to evacuate during Katrina, and they left their kitty upstairs in their bathroom, and they left food and water and litter, and off they went. It was a couple of weeks before the cat could be rescued, but I think that's one big concern, especially in our older population. If there's an emergency and you have to go to a cooling centre for your own health and well-being, sometimes pet owners will stay home and put themselves in danger rather than go and be safe. So is that part of our conversation in terms of emergency planning in the city? I know this is sort of slightly tangential to what we're talking about, but there's a lot of interconnectedness between all of these issues.
Absolutely. While we don't really have a plan to address the amount of the population that we serve. For residents who communicate that they are concerned and they need assistance, we do have crisis boarding, and we've extended that type of service as far as taking animals in so the owner is able to get themselves into a cooling center. We've extended that to some of our population who are homeless on a few occasions, and I believe that our partners at the MSPCA Angel also have, and I know that the Young Rescue League has also extended those types of services for people who are homeless. But at no point would we get communicated that someone needed assistance with getting cooling for themselves, and they would not be able to access that because of a pet and not provide some sort of support, whether it's through our organization or connecting with one of our community partners.
Very good, thank you. That's all I have for now.
Okay, great. And sorry, can you remind me how many of these moving low-cost clinics we run?
So we had typically been holding 7 of them in 2021. We moved that number to 11. In 2022, we will have 11, and in 2023, we have 7 to date, with a plan to support additional clinics in the fall of 2023. So 11 clinics.
Okay, so we think we're sort of at least treating 11 as our new normal.
Yes. Yeah.
And then we
Our
can
benchmark.
try to go up from there
Yeah.
with further support and resources.
For sure. Thank you.
All right, well, thank you guys so much. I do want to get our second panel up here. So I think I'll invite them to join us. We're being joined by Ms. Alyssa Krieger, the Community Outreach Program Director from the MSPCA, Dr. Leslie Sharkey and Dr. Jennifer Grady, both from the Department of Clinical Sciences at Tufts University, and then Dr. Edwards Chatino, the President and CEO of the American Rescue League of Boston. So I think we'll start with our folks from Tufts, and then I'll go to Alyssa. So. Okay, and I'm sorry, you'll have to identify yourself to me, but Dr. Sharkey and Dr. Grady, why don't we start off between you guys?
I defer to Dr. Grady.
Good afternoon, my name's Dr. Jennifer Grady. I'm a veterinarian and a clinical assistant professor at the Cummings School of Tufts University at the vet school out in Grafton. I'm a veterinarian out at a clinic called Tufts at Tech. That was a collaboration between Worcester Technical High School, a vocational high school in Worcester, and the Cummings School back in 2012. And the idea behind that collaboration was sort of threefold. One, to train fourth-year veterinary students in primary care, general practice medicine, as well as spectrum of care to care for patients with flexible treatment plans to accommodate owners' financial and other barriers to care. Also to train vet assisting students out of the vocational high school program at Worcester Tech. And then also to serve a low-income community of pet owners in the greater Worcester area. And so there are financial qualifications for clients to bring their pets to Tufts at Tech. It's SNAP, so the Food Assistance Program, WIC, Worcester Public Housing, the Worcester Housing Authority, as well as having a student in the vocational high school. Those would be the qualifications to come there. It started out as 1 doctor and 1 technician, and now the program has 4 full-time doctors. I think we have 3 CVTs, 2 vet assistants, and a receptionist on staff, and we see about 5,000 to 6,000 animals a year, with the veterinary students as kind of the primary clinicians under the oversight of faculty doctors. We do urgent care, we do wellness care, vaccine type of things, we do surgery, elective and urgent emergency surgery, and dentistry. And the clinic was opened with an idea that it would be more of a wellness clinic, but we found that actually the need of that community was much higher towards the urgent care and emergency type of care, and the community we serve often can't afford traditional pricing for especially emergency and sick animal care. So we see the bulk of our caseload is animals that are sick rather than just wellness and vaccines. What am I forgetting?
I think that's pretty comprehensive.
But I would also say, the language barrier really resonated with me that you were speaking about earlier, because we think a lot about financial access to care. But the language barrier is also a big challenge that we have with care, and we do have a vet assistant who we hired who's a native Spanish speaker, and we have a veterinarian who also speaks Spanish, and it makes a huge difference for the quality of care and our ability to provide care for a Spanish-speaking community. We have about 20% native Spanish speakers in our client base. So I think that's really huge when we're talking about barriers to care, is addressing those language barriers. And we do have way more need than we can provide service for. So we book months out for dentistry and surgery and well care appointments. And we do have to turn people away frequently for appointments because we can't manage the need that's there. So,
Jenny, could you speak a little bit to the transportation, how you guys manage the transportation barriers and working with individuals who have disabilities, and speak a little bit about the kindness funds and the sort of philanthropy?
Yeah. There's so many barriers to care that we've bumped into. A lot of clients have transportation challenges, and so we have gotten grant funding to be able to provide cab vouchers for clients coming, so they can get a cab voucher and get transported out to the clinic and then back to their home with their pet. And then another arm of Tufts also does some outreach where they actually take students and vaccines and go to different addresses in the Worcester Housing Authority to provide care as well. And then we have separate grant funding that actually provides care that the veterinary students can request to use funds to help owners with bills that they can't afford the full amount, which we call the bridge grant, meaning it bridges the gap between the need for care and their financial inability to pay for that care. And the veterinary students really have relationships with the clients, and so they can let us know where that money is best needed. So we do have we're lucky to have a lot of resources to help, aside from just existing. And our prices are about a quarter to a fifth of the national average for veterinary services. So it's not free, but it's a greatly reduced cost. And our clients love their pets quite a lot, which probably doesn't need to be said in this circle. And they're so devoted, and they do spend quite a lot of their resources on their pets. So it's really great to be able to provide them with care.
Great, thank you so much. Dr. Sharkey, do you want to add anything?
My perspective is a little bit different. I did similar work to Jenny in Minnesota and came here, and here my role is department chair. So I have a sort of a policy and finance sort of perspective on things. So I'm not sure, if anyone is aware, but we are the only veterinary school in New England. So New England is actually underserved when it comes to producing veterinarians. Unlike my previous institutions, we're not a state school, so funding is quite challenging for us, and so that's something that we work on all the time. I think the role of the vet school here, our primary mission, we love to work in these communities, but our primary mission is really education and innovation. And so I think the role of Cummings School is providing students with an education, including working in the clinic where Jenny does, where we're really teaching them to work with the entire breadth of pet owners, and making sure that they have the skill sets necessary to provide care plans at different levels, whether we're talking about money or whether we're talking about language or whether we're talking about individuals who have disabilities and say can't read labels or open pill boxes. There's all sorts of things that we need to support them around. There's a lot of discussion now about whether there are not enough veterinarians in the United States, and do we need to increase our pipeline of veterinarians. How do we train the veterinarians? So I think those are things that come to mind in terms of partnerships with the larger communities.
Great, thank you. I think what we'll do is we'll go to Alyssa and to Edwards, and then we'll do questions for all of you. So Alyssa Krieger from the MSPCA.
Hi, thank you so much for having me. My name is Alyssa Krieger. I am the Associate Director of Community Outreach at the MSPCA. I'm excited to talk about this because it's all I ever talk about. So I'm glad to have someone who is interested in listening. A lot of the things that I have written down have already been said, so I'll try not to repeat too many of the things. But in terms of like what we currently provide, we're excited to partner with Alexis and Boston Animal Control to help producing those vaccine clinics. We also do 4 clinics a year in the city of Boston at least that are usually held at housing authorities. So we typically do 2 at the Mildred Haley Apartments, given that it's the biggest Boston housing complex, and then we've been doing them at Archdale as well in Roslindale. And at those we provide the same, so rabies, distemper, and microchipping, as well as like brief exams and vouchers for spay-neuter. We also provide free or low-cost spay-neuter to residents through our community clinic at the Boston shelter. And in 2020, we opened what was previously just our shelter and spay-neuter clinics up into a more urgent care clinic as well. So we're now providing urgent care for broken legs, wounds, pyometras, a whole range of sort of more emergent medical care for low-cost clients. So it's a kind of a similar model to what Tufts at Tech is doing in that regard. We know that what we can do doesn't really scratch the surface. One of the things that I see as like a really critical missing piece is that what's in between the vaccine clinics and the urgent care. So managing diabetes or allergies or like kind of long-term chronic issues that require continual care from a regular veterinarian can be really hard, especially for low-income families, A, in terms of getting to clinics, and B, in terms of the cost of that. And I think like it's important to recognize that while the cost of care is completely a barrier and the number of veterinarians and available appointments is completely a barrier, there are a lot of other barriers, like we talked about transportation, whether that's because you have a large or fearful or aggressive dog that you can't put on the MBTA, or because you have a cat who, if you take it on the bus for the hour that it takes to get to a vet clinic, it's going to be so stressed out by the time it gets there that a vet's not going to be able to physically touch it. Those kind of transportation issues are real for a lot of people. But there's also the issue of that a lot of vet clinics practice during regular business hours, where many people are working, and if you're working and living paycheck to paycheck, being able to take time off of work to go to a vet appointment is not a possibility. Or that you don't know where to go, or what your closest clinic is, or what resources might be available to you. Like for example, in Alston, there's the Merwin Vet Clinic, which is like the longest standing and like most wonderful free or low-cost vet clinic in the city. It's been there forever, and a lot of people might not even know it's there. I don't think anywhere else in the city has something like Merwin, except for now us in the ARL are doing more over the past 5 years. But so not knowing where to go, but then again, if you do know where to go, the language thing is also an issue. So being able to communicate complicated medical issues in a language that you're not comfortable in or that you don't speak at all is really problematic. So we also have hired a few people who speak Spanish and who are able to help, but there are lots of other languages in the city that we don't have anybody who speak. We do have a translation service, but even the translation services are hard because it's like medical conversations, so that's really an issue. And And then I think that there's the issue of the feeling of judgment when low-income families go to a vet clinic. And so there are many vet clinics and vets who are wonderful and inclusive and really take time to meet people where they're at. But I think that we've all in our lifetime or in our careers heard somebody say, like, if you can't afford a pet, you shouldn't have one. And that feeling, I think, is really felt by communities who have less money. And so when they go to a clinic and the gold standard of care is suggested, but they can't do that, there's definitely a feeling of like judgment and a feeling of like nervousness, like are they gonna get in trouble? They couldn't do quite what was recommended. And so while I recognize that vets are stressed and stretched thin and doing the best that they can, there is, I think, a lot of room for a culture shift where people can feel a little bit more comfortable, or where people can feel like they could be on a team with somebody to discuss all of the options and make choices for their specific situation, rather than like, you have to get these 12 vaccinations and these tests and all of these things that you can't afford, rather than like, what I really need from my specific pet and my specific situation. And I think if there is more of a culture of really trying to figure that out, it might also take away some barriers. So we, at the MSPCI, in 2018 started our community outreach program, which is in Dorchester and it's in the 02121 zip code of Dorchester, which is a very small zip code, and Roxbury, so 02119. We provide free spay neuter, vaccinations, transportation to those appointments, but also we are there all the time. We're in the community, listening to people, talking to people, answering questions, and putting people in touch with either our resources or other resources so that they know what is available to them. And creating that trust in the communities has been really like, I love it so much. And also just like really impactful because there are a lot of people who may not seek out the information. And so us being there on a regular basis and getting to know people and building trust, especially because, listen, the MSPCA has been around for a long time and we've done a lot of things. We have a law enforcement department, we have the shelters that historically it was, if you can't afford care, surrender your pet. And so there has been some trust issues with us given that history, and I think that it's important to recognize that we used to do that. Like, if you couldn't afford care, just give it to us, we'll find somebody who can. And now we obviously are working really hard to not take people's pets as much as we possibly can. We're, running the clinics and doing all of those things, but building back trust in the community between the institutions of, the MSPCA or just generally veterinarians in the city, I think is a little bit of it's going to require some work for us to do. And I think that that's another just important thing for us to kind of be aware of as we go forward. So those are the things I kind of just skimmed through this, but I'm really excited. I think this is a really awesome first step, and so it's not going to be a quick or easy road. There's a long way to go and there's so much to do, but it's really exciting to start thinking about.
Great, thank you so much. Going last on the panel to Dr. Schettino, the President and CEO of the American Rescue League of Boston.
Thank you very much. Thank you for inviting us here this afternoon on this very important topic. Really appreciate it. I'm Dr. Edward Schettino, President and CEO of the Animal Rescue League of Boston. The Animal Rescue League of Boston was founded in 1899 by a social worker in Dorchester, Anna Harris Smith. Anna Harris Smith saw the cruelty and neglect of horses and dogs and cats on the streets and children that were being desensitized to this trauma, and that's how she founded the organization. We have 3 brick and mortar locations. Our largest is in the South End in Boston. We have one in Dedham and one in Brewster. Many of our community services are focused right here in Boston through our mobile services, particularly in Dorchester, Mattapan, Roxbury, and East Boston. In 2021, we served over 23,000 animals, which included over 9,000 animals here directly in Boston. Our mission is to be an unwavering champion for animals in need, committed to keeping them safe and healthy in homes and out of shelters. We have over 100 employees and over 1,000 volunteers. We are a nonprofit. We receive no state or federal support. We rely solely on the support of individuals, foundations, and grants. As an animal welfare organization, we provide a holistic approach to animal welfare. We do this through a variety of programs, as well as our partnerships with human service organizations. We partner with Action for Boston Community Development, ABCD. We partner with The Base in Roxbury. We partner with Boston Senior Home Care, Boston Public Housing, New England Center Home for Veterans, Dorchester YMCA of Greater Boston, and even Zoo New England, the Franklin Park Zoo. But today I'm going to focus on our programs that provide accessible, low-cost veterinary care. Besides the 3 brick-and-mortar locations, we have 2 mobile vehicles, the Spay Wagon and the Wellness Wagon. The Spay Wagon is our mobile surgical unit that provides low-cost, high-quality, high-volume spay or neuter surgeries. It allows us to meet pet owners where they are, providing care in areas that are often underserved. Starting in 2000, the Spay Wagon focused mainly on Cape Cod and the South Shore, but we've been able to increase our services to here in Boston. Since the inception of the Spay Wagon, we spayed or neutered over 66,000 animals. In 2020, the Spay Wagon returned back to Boston, and we have spayed roughly 600 animals in Boston, approximately 250 surgeries in Boston annually since creating our new partnerships. In 2015, ARL undertook a strategic shift. We asked ourselves, what services can and should we provide to keep pets and people together before the decision has been made to surrender their pet and the human-animal bond is broken? In 2017, the Animal Rescue League of Boston began our Healthy Pets, Healthy Community initiative in Boston. We've identified areas of focus throughout Boston, one of which was Codman Square in Dorchester, an historically underserved community that is in the center of an animal care desert. Animal care desert meaning minimal veterinary care, minimal supplies for animals as well. The goal of our program in Codman Square was to create a partnership with community-based human service organizations to understand and support the link between the health of animals and people, understanding that a community cannot be healthy without providing services to animals that live in their community, the One Health concept. We perform partnerships with the Codman Academy Charter Public School, Codman Health Center, Dorchester YMCA, and Boston Senior Home Care. We learned for the 2 years that we were in Codman Square 3 things. The need in the community was for accessible, low-cost veterinary care. The community needed access to quality pet food and supplies, and accessible and low-cost information on basic animal care and husbandry. After listening to the community, we partnered with the Codman YMCA, and we held weekly pop-up clinics in their multi-purpose room. For $10, the community was able to bring their dogs or cats for a wellness exam, vaccines, minor things that were wrong with their pets and needed a checkup. However, the YMCA needed their space back. But we also learned in the community that a lot of underserved communities, there's a lack of trust between the community and nonprofits. There's a feeling of being used, there's a lack of commitment and consistency. So when the YMCA needed their space back, we refused to leave, meaning we were in their parking lot in a tent. We were there providing services to the community. We also started to understand that there were other communities besides Codman Square that needed our assistance. So to provide accessible veterinary care in multiple communities, we realized that we needed to be mobile. So in 2019, the Wellness Wagon began. It's a mobile, full-service veterinary clinic. The Wellness Wagon provides, for $10, veterinary exams for dogs or cats. It includes a physical exam, rabies vaccines, distemper vaccines, flea treatment, microchip, and basic medical concerns are addressed, such as skin issues, ear issues, which are the predominant. These would normally cost about $300 in a full-service veterinary hospital. ARL has partnered with Action for Boston Community Development to have permanent locations for our Wellness Wagon. ABCD saw the value of this partnership in providing care for the entire family, including pets. We know that one of the most crucial items in accessing care is continued and reliable access. Our current access through ABCD, once a week we're in Dorchester, once a week we're in Mattapan Hyde Park, once a week we're in Roxbury, and every other week we are now in East Boston. Due to the need, we limit services to those who live in the communities. Appointments are booked far in advance, and we do take walk-ins. Even though it's $10 is even too much, and we do accept whatever people can give us, if anything. This is a fully subsidized service by the Animal Rescue League of Boston. We know that there is a desire to increase the number of locations we serve, and in fact, ABCD has reached out to us and wants us in Alston and Brighton. However, we can't. we are limited by funding. Funding to hire the appropriate staff and funding to pay competitive salaries to retain our veterinarian technicians. It is vital to be in the communities we serve regularly, to create relationships and be able to serve enough individuals. And without substantial funding, we're unable to serve additional locations, and we're limited to the locations we're currently in. In the identifying locations to focus on, ARL looked at a number of metrics. And one of this was how many animals are being surrendered from these communities. The Dorchester zip codes consistently had the highest number of animal surrenders. Our Dorchester location for the Wellness Wagon has existed the longest and provides the best indication as to the success of this program in keeping pets and people together, families together. Preliminary data shows since 2018, total owner surrenders from the zip codes we serve have decreased. Owner surrenders from Dorchester zip code have decreased 25%. Owner surrenders from Mattapan have decreased 33%. Owner surrenders from Hyde Park have decreased 19%, and owner surrenders from East Boston have decreased 28%. Our goal is to provide resources so families can keep their pets and stay whole. Data shows that providing accessible, low-cost veterinary care can keep pets and families together. And once again, this creates a healthy community for both the people and for the pets. Thank you very much for this opportunity. Greatly appreciate it.
Great, thank you so much. Thank you to all the panelists, and I'll go now to the sponsor for questions.
Thank you so much. Many inspiring stories. And a whole spectrum of ways to go at it, you know. I know you speak highly of Merwin Clinic. I'm very familiar with Merwin. I think they're bending under the strain of increased demand, a huge increase in demand. I think they used to have a clinic twice a week. I think they're doing a clinic 5 times a week, and there's people queued up down the street every day. I think they're only closed 1 day a week now. Yes.
Yeah, they're incredible.
Yeah. So there's a huge demand and there's a huge need. And I think just in the present climate with increased inflation and the cost of living in our city, we have so many residents who need that accessible, low-cost care that you're talking about. So in terms of, you know, you can't expand in Dalston Brighton, even though ABCD would love to have you. In terms of expanding, like, what are your funding sources, and how do you fund what you do already, and is there anything we can do to help?
There's a lot you can do to help. Our funding sources are through private supporters. The majority of our funding comes through our service revenue from other programs we have, a third, and then the majority comes from private supporters, foundations, and grants. Having local community support, federal support, state support would be extremely beneficial to help us continue these services and expand these much needed services. We have the infrastructure. We have the core competencies. We just don't have, unable to have the proper staff so we can be on the road 5 days a week, 7 days a week. We're on the road 3.5 days a week because of that limitation.
Mm-hmm. And I really was interested to hear the sort of wonderful collaboration and partnership you have with the Worcester Vocational Technical High School. It seems like your veterinary students are getting a great opportunity to interact with a wide range of, clients and their pets, and then the high school gets an opportunity to train their veterinary technicians and folks who would have a career maybe as veterinary care technicians going forward. So it seems like an ideal partnership. So it's really low restricted to the Worcester area, or do you do satellite clinics and anywhere else out in the western part of the state?
I don't see anyone from Massachusetts that meets the financial qualifications. So it's not just the city of Worcester, but we do see quite a lot of pets from the city.
Mm-hmm. Okay. And, I'm just thinking about the need for more veterinary personnel, not only the doctors, the veterinary doctors, but the veterinary technicians. Is there any conversations about expanding veterinary technician training within Boston, and like at our vocational high school Or is that something that we should be looking at as a way to increase our personnel capacity and to do basic sort of support care rather than the fully licensed veterinarian?
You're correct. It's not just about veterinarians, it's support staff. It's certified veterinary technicians, and assistants that are very much needed and very much are important, are the key behind a successful veterinary practice, low cost or otherwise. There are very limited programs in the state that offer certified veterinary technician training. I don't believe there's any in Boston. There's North Shore, there's one, Western Mass, and on the South Shore, there's one as well. So increasing or evaluating those opportunities, I think, would be incredible to provide another avenue for people to get into this field. That's our relationship with the base in Roxbury. It's providing mentorship opportunities to provide children, young kids, opportunities, understanding that there are careers in animal welfare. Not, excuse me, you don't have to be a veterinarian, but there are careers in animal welfare and there are opportunities. And that was part of our relationship with the base, is providing that to start hopefully the pipeline of young children that are from Boston getting more involved, and also help diversify animal welfare, which is also a struggle that we do face.
And I think you bring up an important point here. I'm just curious in terms of you're a leading veterinarian school in New England. You're the only veterinarian school, but in terms of diversity of the folks who come into your veterinary programs, what does that look like in terms of being able to, folks see veterinarians of colour or folks with language skills that would inspire them to become veterinarians? Just curious about what your diversity is at your veterinary school.
Well, I would say as a profession, veterinary medicine is one of the least diverse professions. I think that is improving.
So across the country, in the AVMA, the American Veterinary Medical Association, is aware of this issue, and so there are diversity initiatives at the national level. Tufts University just embarked on a big diversity, equity, and inclusion sort of program where that's a lot of focus. I think that having efforts like MSPCA and ARL go into underserved neighborhoods and model, even having veterinary medicine present in these communities is a good start. I think what Jenny and her team are doing, in a school where there are more students of color and giving them, really strong connection to the profession early. I just wanted to speak a little bit about the technician situation. During COVID, 2 of our largest vet tech programs in our area, Becker and Mount Ida, closed. And we have an issue of student debt at the technician level and the veterinarian level, so that it sort of, the debt loads make it harder for technicians and veterinarians to choose jobs. It puts financial pressure on our partners because the veterinarians and the technicians need to make a salary that allows them to pay their educational debt. And so that's just another struggle that we all kind of share. We wish we didn't have to charge that much money. And we struggle with it too. So we have spent a lot of time at Tufts, a focus of fundraising on scholarships. But
the MSPCA has some tuition reimbursement opportunities as well for folks who are entering veterinary technician programs that work for us. So that's one of the ways that we've been trying to address it as well. One of the other things that I just wanted to mention is that we've been in communication with the Curley School about getting some just like early education about animal welfare jobs and things like that into kids' heads now while they're, so doing that kind of like programming in schools is something that we are hoping to. The Curley's just right around the corner from us, but the more we can kind of get into the like middle school, high school kind of age group and talk about, being a veterinarian or a vet tech or any of the other, kind of positions that are available in animal welfare is something that we hope to do to increase visibility and diversity and that kind of thing in the city.
Yeah, a number of our faculty are involved in K through 12 STEM outreach programs, and there's a national program out of Purdue University called This Is How We Roll, and it's sort of diversity focused, and so we're a participant in that program as well.
Well, and being in a vocational high school, we find that even though they qualify by going to the school, many of the students at the high school would also qualify financially to come to the clinic, and they are in the same community as a lot of our client base, and we've hired a couple of graduates from that program. And so I think also having staff from the local community is important from a diversity perspective, and just like you're talking about, the relationship with the community and the trust issues, overcoming a lot of the community barriers to care.
And we just had our first high school student. Do you want to tell that story?
Well, our first vet assistant high school student recently graduated from veterinary school. So, and there is some scholarship money to send specifically the high school students coming from our program, those interested in going to veterinary school, to help fund their veterinary education as well. So I think having that pipeline is also important to increase the diversity in the profession.
One of the things, as Dr. Sharkey mentioned, one of the things I'm most excited about with our Wellness Wagon is when the Wellness Wagon shows up in a community for appointments, it's not just the pet and the caregiver of the pet. Usually the family comes along. And it's an opportunity for a child to see something new. Like most veterinarians, I was exposed to that when I was young, and that's why I wanted to go into this profession. And if it's not seen, you don't know it exists. And just having a young child see it, and hopefully there's a spark that sparks that could then lead to a further understanding of what needs to happen to pursue that career. And that's what I'm most excited about, because diversity in animal welfare in veterinary medicine have to start with children. And that's what I'm really excited about with the Animal Rescue League and our partners, exposing folks to a new opportunity.
Questions?
A few questions from me, I guess. I mean, one would be, and forgive my ignorance, but the, like, how does veterinarian compensation broadly work in the US? Like, is it, like, I know that on the doctor side, obviously lots of people make their money off of fee-for-service. And so I'm just curious, is that also how, and the reason I'm asking this is because I'm trying to think about when you set up competitive low-cost models, presumably you need to salary your veterinarians at a rate that still allows them to service their student debt and is vaguely competitive with, you know, doing higher cost service. So I'm just trying to understand what the model is.
There's a huge discrepancy. As a veterinarian, most veterinarians graduate veterinary school with a significant student loan. And so you need to repay your loans and you need to survive. So working in private practice, going into an internship or a residency, becoming specialized, there is more income that comes in when you do that. Working at a nonprofit like ourselves, and I'm assuming the MSPCA, we don't have those resources. Veterinarians get compensated with a fee-for-service, as you mentioned. There isn't a fee-for-service for $10 for a wellness exam with the clients. So we do have to pay competitive salaries. It's challenging, and that's why attracting veterinarians to the nonprofit shelter and community medicine, retaining veterinarians so they do have quality of life and are able to pay off their loans, it's very challenging, and offering new programs. So it's very different.
And what is the sort of, like, can you give me a ballpark of, like, what's average compensation in the private veterinary world versus?
It varies dramatically. I would assume between.
Well, I mean, there are regional variations and variations depending on whether you work in large animal or small animal. But I would say most entry-level graduates, and Jenny, you might know this, you know, they're probably working in recently it's gone up a lot, but like 80 to 120 for new grads might make that.
I was going to say, I think a lot of the new grads who are going right into practice are in the $100,000 to $130,000 a year if it's small animal, private, general practice. And that's been a recent increase as there's been a sort of a shortage of candidates for jobs and a high need for veterinary care. That I think the salaries have gone up.
And so now we have a little bit of a problem on the university side because we pay our faculty who get additional 4 to 10 years of training after vet school. We pay our faculty essentially pretty much what the new grads are getting. We're really strained. So we have lots of open positions, both at Tufts and at veterinary schools across the country. So our model needs some revision because the vet schools across the board have been unable to respond, probably just very similar to you. We are unable to respond in the same way as commercial practices to these market forces, and yet we're the ones producing, the new veterinarians and working in these underserved areas. So it's tough. We need some better solutions.
And you were saying that there's a shortage of veterinary training schools here in our neck of the woods, but are we also seeing, do you guys get fully subscribed, or are there spaces that are going unclaimed even?
Oh no, we have many, many more applicants than we can accept.
Okay, got it.
Yeah, and I think the issue that we get into from a diversity standpoint is that our diversity, I think we lose diversity applicants because of the price tag. Mm-hmm. So I think there are people who would like to go to vet school who maybe have had the benefit of having, some positive experiences with one of these, one of the other individuals sitting on this panel. And yet, there's just no way that they're going to be able to make that choice to go to vet school.
And these veterinary technicians, what kind of jobs are those? You have a bunch of technicians.
We have, so it's vet assistant. So if you think about the human field, the veterinary technicians would be sort of analogous to nurses.
Right.
And then the vet assistants have less training than the technicians. So
like
they are
CNAs maybe? Like
okay,
a CNA.
yeah, that's a good analogy, yeah. And so they can go right out of the vocational school. They get a vet assistant, they take a test and they can become certified right out of high school, and they can go into vet assisting, or they can continue on to school to become a technician. But I believe that would be 2 more years.
At a minimum 2 to 4, depending on the program.
To train to be a veterinary technician, which is sort of a step up in terms of salary and also job responsibility. But the veterinary assistants and technicians are not paid appropriately for the work that they do. And more dramatically than veterinarians, their salaries are too low, and it's hard to retain good folks in those positions because they do the bulk of the challenging work and don't get compensated appropriately. So that's a whole nother issue facing the profession.
Yeah, no, I asked because, I think here in the council as we work on kind of workforce development issues in the city in general and equitable access and how do we get on and underemployed young people in Boston into various tracks. I think one of the things that we find appealing, and this is with due respect to great, educational institutions, 4-year or however many year educational institutions like Tufts, is that we, trying to identify what's the actual credential needed for the work, and can we make that accessible at a price point that's accessible, in a way that most directly ties that kind of educational credentialing to a job at the other end, and one that doesn't have this kind of debt earnings mismatch. I think that's, for us, been kind of the direction that our Office of Workforce Development's been pushing on a bunch of different fields. I haven't had the opportunity to discuss veterinary care before, but.
Yeah, you pair 2 techs, 2 good techs, a good assistant with 1 doctor, and they can take over the world, I think.
Yeah.
Very true. Very true. Half a doctor.
Half a doctor, yeah.
No, it's, yes, we just in the city of Boston, again, in a different field, unbundled our arborist positions, realizing that, well, there's some very specific things that we need fully credentialed arborists to be overseeing, Like, the arborist needs to tell you can't cut that branch off the tree because it'll throw off its balance or it'll kill the whole thing. But like, he doesn't actually also, he or she, or anyone, right, doesn't actually have to be the one who cuts that branch, right? And so in the city, we're trying to deal similarly with like a shortage by unbundling and thinking about what are the ways to make different pieces of tree care accessible to our community, and then create a step ladder so that folks can move towards the arborist credential. So it seems similar.
Well, Roxbury Community College, I believe they had a vet tech assistant program. I'm not sure if they still do. And that is something that I think should be evaluated and looked at, because a vet tech assistant program, I think there's minimal debt, if any, coming out of that program. And then they can work in any veterinary setting. And that is a wonderful career pathway to get started, to experience if you like that field or not. Then there's many directions to go into. And that would be extremely helpful for nonprofits, for private practice, and this huge opportunity. I'm not sure if Roxbury Community College still has that or not.
I think Bunker Hill did as well.
Okay.
At some point too.
You think Bunker Hill had something at some
I
point?
think that they did. I'm not sure if they still do as well.
Okay. Well, I think that's something for us to look further into and follow up on. I also think that, obviously as we think about like what could the city do that's more robust for us, like, because the municipal side can never solve all of the need, right? Neither can any of your organizations. But, thinking about, are there ways to pair stepping up municipal offerings with some kind of pipeline or training program, right? So that you're kind of having an impact beyond just the number of appointments that you can cover feels attractive. But I feel much better educated on all of this and hugely appreciative of everything that you guys are doing. It was really great to hear. I grew up in Bay Village, just across the street from the brick and mortar for the Animal Rescue League. So I have a personal attachment to the organization for that reason. But thank you for all this work. I mean, it just seems like one of those things where our kind of public provision of services is not aligned with the centrality of it for people in people's lives, right? Like, I think, and I understand how that's ended up being the case, because of obviously, this is a chamber where we talk about all kinds of human needs every day, but obviously the pet and animal welfare world is also part of kind of our overall community needs. So I appreciated the education on One Health as well. I want to pass it off for a closing statement to my colleague, Councillor Braden. And then I will be going in a moment to public testimony. So I just want to remind anybody who's here to testify that if you haven't yet, you should definitely sign up on a sheet in the corner, or you should email ccc.csit@boston.gov so we can get your testimony. But
I just want to thank you all for being here. There's one just follow up on our conversation about the cost of veterinary education. Does veterinary, in the medical sphere, doctors, nurse practitioners, and physicians' assistants can get some support with paying off their student loans if they serve in a community health centre? Do we have a similar sort of program for veterinary care?
Yes, there is. Veterinarians working for a nonprofit, I think 10 years qualifying with a federal loan, I think is a 10-year requirement, and it all depends on a lot of other things, but yes, it does exist.
I think there was a nervous moment.
Yes, more that moment.
Do you want to share about that?
No, you can.
Okay. Well, the federal government, being what it is, put that on the table to just make it go away. And so I think a lot of people feel that they're uncertain of the federal commitment to that program in the long term. So the AVMA does a lot of advocacy because we do see that as part of the solution. But 10 years is a long time, and people are not sure. There's nothing written that says if you start this program, you will finish it. Mm-hmm. And so Congress every once in a while just takes a look at getting rid of it, and so people get very anxious.
I know 10 years is a big commitment, but even a 6-year commitment would be more manageable. You get your head around that better than. But anyway, it just seems like I'm glad that's an option. So in summing up, I really want to thank you all for being here, and thank you for being here as well. this is a conversation I think we need to continue. There's obviously a great need out there. I see the queues, I see the lines of dogs and cats and people outside the Merwin Clinic every week. So, and I know this is we're not the only neighbourhood that's got this. I'm delighted to see, folks adopting animals from shelters and taking them into their homes and, seeing this change that we have had. But the need for affordable, accessible healthcare for our animals is really important, given the cost of living in the city of Boston. So I appreciate all your work. Thank you so much. And I think we'll be continuing this conversation in whatever way we can in terms of even vet tech training and all sorts of different angles on this to see if we can move the ball down the field a little more. Thank you.
Thank you.
Thank you.
So yeah, thank you. I'll echo Councilor Braden's thanks and also say that, we look forward to further work on this with you all as partners and also with our folks here in the city, whom we hugely appreciate. I guess we don't have any public testimony, so I'll remind folks one more time that if you want to send something after the fact, if you're watching this, you can send it to ccc.csit at boston.gov, and yeah, much more to come. It sounds like something, going to be going into budget season again before we know it, so it's good to be talking about it, and I think also, good to think about just all the ways at the state and the federal level and everything that we can support you all. So with that, this hearing of the Boston City Council's Committee on City Services and Innovation Technology is adjourned. Thank you all.
Thank you.
Thank you.